Kotsirilos. I'm a part-time GP in Clayton, and I also regularly lecture to doctors on integrative medicine, lifestyle and nutritional medicine. I welcome you all. It's such a nice morning in a beautiful setting of trees, nature surrounding us. I hope you all have a chance to go for a walk after the conference. I'd like to firstly acknowledge, is that working? Yep. I'd like to acknowledge some of our Australian integrative medicine pioneers, of whom we've got two here today, Dr. Ian Gawler and Professor Mark Cohen, for helping to pioneer even before the days that I came about. And I'd like to acknowledge Ruth Gawler, Dr. Ruth Gawler too, one of my closest colleagues. We've all worked hard in helping to pioneer integrative medicine in Australia. And I also want to acknowledge the younger pioneers, such as Dr. Sanjay Raghav, who's also lecturing here today. Hi, Sanjay. Good. My other acknowledgement also goes to the traditional healing systems such as Ayurvedic medicine and yoga that have come from India and has enriched our own health system. Am I keeping it up? Great, good. In Western medicine, a lot of our traditional drugs have come from the herbs and traditional healing systems. So for example, if you're a diabetic, a common drug, metformin, comes from a herb. Asthmatics take a drug called sodium chromoglycate, which comes from Ami Visnaga, which is an Egyptian herb. Digoxin for heart condition comes from a herb. There's a lot of good, useful drugs that we are still using today that have their origins from the herbs. So I can't see the screen, so I'm just being faithful and hopeful that you're all seeing what I'm seeing. So what you should be seeing now are some red poppies. No? What have we got? One more? Okay, thanks. So what I'll do, I'll get you guys to help me, to guide me. So what you should be seeing now are some red poppies and the opium that comes from the poppy plant. Oops. And what are some of the drugs that we use today in hospitals for pain relief? Do you know any? Great, thank you. If you're not sure, morphine, codeine are common drugs that we now use today. Now, do you now have a picture of a tree there? Yep, terrific. Now, does anyone know what this tree is and which drug comes from this tree? Any guesses? Yeah, put up your, it's just sing out. Go on. Yeah. Perfect. Spot on. Well done. So, well done. Repeat it? Yeah, I will. So, as the lady quite rightly said, if we go look closer at this tree, at the bark, it's called the white willow bark, and it's been used for thousands of years, and it's been used for fever, pains. Now we'll go closer, and this is what it looks like when it comes closer. And what happened? Now, do we have some text material here titled White Willow Bark, the history? Not yet? Okay. Here we go. Thanks, guys. Good teamwork. Okay, so the white willow bark tree, that we know that even in Egyptian times, we found them in the Egyptian pyramids. It was used by Hippocrates for fever, aches and pains. And in the 18th century, they extracted the chemical acetyl salicylic acid, which today we use as aspirin, a very common drug that now we synthesize it, we make it in factories, but in the old days, it came from the herb. And a lot of people are often surprised. Aspirin is commonly used for prevention of heart attacks. It's still used for fevers and aches and pains, and it originally came from the herb. Okay, so we got a picture of a garlic here. Okay, so like the white willow bark, also garlic has been used for medicinal purposes for thousands of years and found in the temples. And it's been used for prevention and treatment of diseases. Hippocrates talked a lot about the use of garlic for boosting the immune system, fighting infections. And now we know there's research to show that it can be used to lower blood pressure. It's also been used to show that if you take it regularly, can help boost the immune system and also can lower cholesterol as well. So, my talk is about integrative medicine and what is it? So, integrative medicine is using the best of the traditional healing systems that I've given you examples of, the best of herbs, things that have been shown to have evidence, or also known as natural and complementary medicine, together with conventional medicine, with the aim to use the best of care for our patients. The term integrative medicine is widely used now. We prefer to use it rather than alternative or complementary medicine. We originally wrote about it in the Royal Australian College of GPs AIMA position paper, as in the definition of integrative medicine. And it's also still used by the College of GPs in their curriculum statement when we educate doctors about integrative medicine. Now, when we have now within the Royal Australian College of GPs a curriculum statement of what we'd like to teach doctors in the area of integrative medicine, and it includes mind-body medicine, meditation, relaxation therapies, counselling, acupuncture, diet therapies, nutritional medicine, herbal and spice medicine, environmental medicine, and physical musculoskeletal therapy and manipulative medicine. So are we on the same page here about the Australians' use of complementary medicines? Have we got that up there? Pardon? Oh, hang on. So, we're still on the definition, are we? Sorry about that. I hope you've all been listening. So if I do that, that's the integrative medicine curriculum statement. Okay, so what do I have there? The integrative medicine curriculum statement? Okay. Well, I've jumped too far ahead. This slide is about what we're now teaching about doctors and all the different therapies. Okay, now we're in synchrony, in harmony together, so I'll go forward. Now we've got the use of Australian consumer use. Terrific. Okay, so what we do know from research is that about 70% of our community have used some form of natural or complementary medicine, and about 30% on a daily use. Now, put up your hand for me if you use some form of natural medicine or complementary medicine on a daily basis, every day. All right, so just looking at you are probably, there's over 30% here. So you're actually a part of our community here with over 30% use of daily complementary medicine. So you're representative but are high users of complementary medicine. And put up your hand if you only use it sometimes when you're sick or only when you need it, like echinacea or vitamin C. Good, okay, terrific, great, good to see. Now, unfortunately, 60% of our patients, nearly 60%, don't tell their doctors, and often they're prescribing it on their own. Now, have we got a photo here of Elle Macpherson? No. All right, so what do we have here? What's the title? Consumer use. Okay, that was what I was just talking about. So it might be that this is not catchy on. Now we've got Elle Macpherson. Good. So why have I got Elle Macpherson up here under integrative medicine? Because she's pretty? All right. Because the reason being, two reasons. One, she's representative of the type of, or she's representative of the population who are using complementary medicine. It's most commonly in women. In my practice as a GP, first I see the mother coming to me, wanting to know more about how to treat her condition. Then she brings the children, and she later brings her husband, comes later on. Now, the other thing is Elle Macpherson is a businesswoman. And about 2 years ago, she actually started her own company and is now selling nutritional supplements. So she's clever because she knows there's a growing use within the community and there's money to be made. So she's a clever woman. Ah, great. I can see it now. Perfect. All right, I've got another screen. Lovely. All right. Now don't stand in my way. Bring that table closer. I can actually see it, it's fine. All right, I've now got a screen. So good, so we finally caught up with each other. Okay, so your typical user tends to be the women, middle-aged, highly educated, with more money, higher income earners. But we are seeing these statistics change. We are seeing the poorer, less educated people now getting more into complementary medicine. And I think that pharmacies who are now selling a lot of the nutritional supplements is a good thing because there's competition out there and they're much more widely available. And you've got Chemist Warehouse selling them at discount prices. That's a great thing. That means that these supplements now are going to become much more accessible to our community and hopefully at a competitive price and cheaper. And we know that the majority of our community are vitamin users, followed by herbal medicine, followed by mineral supplements. Yay, I can now see where we're at. Now, what it is, the community, we're not rejecting Western medicine. We want both. We want the best of both worlds, which is what integrative medicine is. But there are people who want a much more natural approach. It's a philosophical choice. We want a natural approach first, or we may have experienced side effects to drugs or to surgery, and or we're not happy with the consultation that we might have had with our doctor. The biggest complaint patients have about doctors is they're not spending enough time with patients. So we are trying to teach doctors within the College of GPs to spend more time with our patients, to provide more lifestyle advice, and to also consider more non-drug approaches, particularly when there's scientific evidence. Okay, there's good news here. The good news is, I've got 2 more minutes, good, that there is research, more research happening in this area. It's a growing body, there is a growing body of research. Dr. Ian Gawler, Professor Mark Cohen, myself, we've all written books about the scientific evidence. If you go onto my website, you'll access even some of the research. I'm trying to update the community on the research, and I'm doing this for free now, and I only just started a week ago, and I'm hoping by the end of the year I'll have 1,000 studies up there, so it's available to all the community to access latest research in this area. I'm also doing work with the University of Western Sydney, where we're going to create a website, and it's going to be for free for the community, so you can all access the research. What's most important, before we move into more natural medicine, when patients come to see me, I tell them that lifestyle comes first. Diet, correcting sleep, exercise, Tai Chi, Qigong, yoga, stretching. The right amount of sunshine is important. Meditation, rest, sleep, having counselling if you've got stress or worries, getting involved with support groups like the Gawler Foundation if you're suffering from cancer or MS, and also looking at the environment. I heard Mark speak when I arrived, talking about the importance of a clean environment and avoiding chemicals are all important. What we do know, our body can heal. If we give our body the right conditions, we can all heal no matter what disease we have, whether it's cancer, whether it's arthritis, blood pressure. Any disease responds to lifestyle. Now, this is coming to the end of my talk, and there's been a little bit of disruption, so I'll just go 1 minute over. But I did a little experiment for you guys. See these petunias here? See how I bought them in a little plastic pot, and they're in a bit of soil there. Well, what I did was I left them in a spot where they got a lot of sunlight, and I didn't water them much, and they're looking quite weary and sick. And then I repotted them, and I put them in soil, which is the equivalent of our food, and I gave them some fertilizer, some nutritional mineral supplements, the right amount of water, the right sunshine, and the growth appeared, and they were flowering. Now, us as humans are the same. We do those lifestyle changes. We obviously have to eat the right foods to get our vitamins, but if we need some vitamins, nutrients, just like our plants might need some fertilizer, we too might need it to help us heal. But clearly diet comes first. And it's really important to know that what we do is safe. It is important to talk to your doctor and be aware that the benefits of what you're taking, make sure it has some benefits, that it has some scientific evidence. It's important not to, that we are cautious about the costs and how much money we're putting into all these things. And sometimes doing nothing is better than doing something. There are many therapies that are safe, like acupuncture can help prevent headaches and migraines and is useful for arthritis, or meditation for depression. What this is, I used to work for the Australian government, the TGA, and while I was working there, I used to look after complementary medicines and over-the-counter medicines, and the majority of the risks and side effects, adverse events, actually came from drugs, 98% from drugs rather than from natural medicines. We often hear about some of the side effects of natural medicines in the media, but we forget that majority is actually from medication. And finally, find yourself a good doctor. Healing not only comes from your own motivation, your own lifestyle changes, but also having a good doctor that you can trust, or a good health practitioner that you can trust. Try to find a doctor who'll show you compassion, loving kindness, respect for what you choose to do, that you can trust. And I always throw gratitude there, because I have patients who come to me and they say, "Oh, Vicki," or "Dr. Vicki, thank you so much. I feel so much better." And I always say to my patients, "Thank you. It's wonderful to have patients like you who can change your lives, improve your lifestyle, and they give me pleasure and satisfaction when I hear them getting better." So the gratitude goes both ways, not just you for your doctor, but also the doctor for you as a patient. So on that note, I'll finish there because I don't want to take up Ian's time. Thank you very much, and I hope you enjoyed that talk. Thank you, Vicki. Thank you.
In a nutshell, if I can summarize, she said, get on to the right environment so that you can blossom. That's the message she conveyed. And thank you very much. And the token of appreciation from us, this is my book on yoga.
Oh, I think I've got that.
Today's souvenir.
Okay. Oh,
Thank you very much.
Thank you.
Okay.
Thank you.
Thank you.
Thank you.
See you then. Okay.
See you.
Thank you. You can get off from here.